Out of COVID-19, tonight a call for federal help inside Arizona hospitals. Right now, just about 5% of beds in the state are open. Many hospitals are stretched thin, limited on staff and on resources. Tonight, Governor Doug Ducey is allocating $35 million to help. It is to pay for extra travel nurses, to add beds, to care for some patients outside of hospitals. Our Nicole Gregg staying on top of the fast-moving developments tonight.
Sources sharing that the state's largest hospital network is all hands on deck. They're activating a disaster documentation for nurses and respiratory therapists. This means nurses and those therapists will focus more on patient care and less on paperwork. The Arizona Department of Health Services sharing these written request forms that they sent to the federal government requesting 133 staff members for 7 different hospitals in our state. Those requests are for rural areas with hospitals in Yuma County, Mohave County, and Cochise County. The request for assistance was made 11 days ago. The state's former director of emergency management telling us,
"This is why you plan. This is why you plan. This is one of the planning factors that you have to take into consideration, and you have to decide early on, how are you going to mitigate this risk?"
Wendy Smith-Reeve knows how these requests are made and says Arizona is not alone when it comes to needing hospital help.
There's a prioritization process that goes in as far as which resource requests have they received and in what order and which one is going to take priority.
As for hospital capacity, Banner Health saying Tuesday they may have to cut back on care next month when they expect to hit their peak. In Phoenix, Nicole Gregg, ABC 15, Arizona.